Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about the instrument called as uterine curette. So go ahead, subscribe, and let's get started. Students, let's look at this instrument called a uterine curette. First, look at the picture. You can see it is a long, thin surgical instrument with a small loop at the end. What is a uterine curette? A uterine curette is a gynecological surgical instrument used to scrape or remove tissue from the inner lining of the uterus. The inner lining of the uterus is called the endometrium. So in simple words, it is a tool doctors use to gently scrape or remove tissue from inside the uterus. There are two main types of uterine curettes, sharp curette and blunt curette. A sharp curette has a sharp loop edge at its tip, which helps the doctor scrape the uterine lining to remove tissue. It is mainly used when tissue needs to be removed from the uterus during certain medical procedures. The blunt curette has a rounded or smooth loop edge instead of a sharp one. It is used when gentle removal of tissue is required, which helps reduce the risk of injury to the uterus. This type is commonly used when the doctor needs to remove tissue more carefully. Now, let's look at the parts of the uterine curette. A uterine curette mainly has three important parts: the handle, the shaft, and the loop or spoon-shaped tip. First is the handle. The handle is the part that the surgeon holds during the procedure. It usually has a rough or textured surface so that it is easy to grip and control while using the instrument. Next is the shaft. The shaft is the long, narrow middle portion of the instrument. It connects the handle to the tip and allows the doctor to reach inside the uterus safely and comfortably. Finally, we have the loop or spoon-shaped tip. This is the working end of the instrument. It is used to scrape or remove tissue from the inner lining of the uterus, called the endometrium. So in simple terms, the handle is for holding, the shaft is for reaching, and the loop tip is for removing tissue. Now let's understand the main parts of the double-ended uterine curette. The instrument mainly has three parts: the handle, the shaft, and the loop or spoon-shaped tip. First is the handle. The handle is the middle thick portion of the instrument. It is usually textured or ribbed, which helps provide a firm grip. This allows the surgeon to hold and control the instrument safely during the procedure. Next is the shaft. The shaft is the long, narrow part that extends from the handle to the tip. It connects the handle to the working end of the instrument and allows the curette to reach inside the uterine cavity. Finally, we have the loop or spoon-shaped tip, also called the curette end. This is the oval or ring-shaped end of the instrument, and it is the main working part. It is used for scraping or removing endometrial tissue from the uterus. Depending on the type of curette, the tip may be sharp or blunt. So in simple terms, the handle is for holding, the shaft helps reach the uterus, and the loop tip is used to remove the tissue. Now let us look at the uses of a uterine curette. A uterine curette is used in several gynecological procedures. One common use is during dilatation and curettage, also called D&C. In this procedure, the instrument is used to remove contents from the uterus. It is also used for diagnostic endometrial biopsy. In this case, a small sample of tissue from the uterine lining is collected for laboratory examination. Another important use is the removal of retained products of conception after a miscarriage or abortion. The curette helps remove any remaining tissue from the uterus. The instrument can also be used in the treatment of abnormal uterine bleeding by removing the thickened endometrial lining. In some cases, it is used to remove tissue in molar pregnancy. It may also be used for postpartum uterine cleaning when small placental fragments remain inside the uterus after delivery. These uses make the uterine curette an important instrument in many gynecological procedures. Now, let us discuss the nursing responsibilities related to the use of a uterine curette. The nurse first prepares all sterile instruments required for the procedure. Maintaining sterility is very important to prevent infection. During the procedure, the nurse assists the gynecologist, especially during dilatation and curettage, by handing instruments and ensuring the procedure runs smoothly. The nurse also monitors the patient's vital signs such as pulse, blood pressure, and respiration to make sure the patient remains stable. It is important to observe the patient for possible complications such as excessive bleeding, infection, or uterine perforation. After the procedure, the nurse provides post-procedure care and gives proper instructions and education to the patient for recovery. These responsibilities help ensure the safety and proper care of the patient throughout the procedure. That brings us to the end of today's session. I hope you found this video informative and helpful. Thank you so much for watching. And don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.